She would always be very inspirational whenever I would see her studying so long. And when she finally got to be a nurse, I always admired her vocation and compassion with her patients. She'd always go above and beyond for all of her patients. I also got inspired a lot by my brother as well. Just seeing how passionate he was for caring for his patients and, like he said, for the families as well, and helping them deal with any grief or loss that they were experiencing.
You're listening to the ONS podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between.
Hello, and welcome to the ONS podcast. I'm your host, Valerie Burger, member of the ONS 50th Anniversary Planning Team. In 2025, 4 different generations make up the oncology nursing workforce: baby boomers, Gen X, millennials, and Gen Z. During today's podcast, we'll be exploring oncology nursing through the lenses of the different generations and hear stories of how one family has made oncology nursing a family tradition. This episode is part of our 50th anniversary podcast series. Tune in every month throughout 2025 as we feature episodes exploring ONS's rich history and promising future. Joining us today is a family of nurses, 2 in oncology and 1 soon to be in oncology. Lissette Gomez-Rios and her children, Carlos Rios and Carolina Rios, will share their stories of working as nurses and how having fellow nurses in the family has shaped them personally and professionally. Thank you for joining us today, Lissette, Carlos, and Carolina.
Hi, how are you?
Hello.
Hi, thank you for having us.
Lissette lives in Miami, Florida, and began her nursing career in 2010 as an oncology nurse at the University of Miami Sylvester Comprehensive Cancer Center. She has worked in a variety of different areas within oncology. Currently, she works at Baptist Hospital, South Florida, in the case management department, covering the bone marrow transplant and oncology units. Lissette is a member of the Gen X generation. Carlos is Lissette's son and began his nursing career as a pediatric emergency department trauma nurse in 2012. After 7 years in that role, he moved to radiation oncology at Miami Cancer Institute at Baptist Hospital, South Florida. And now he works at Nicholas Children's Hospital on the pediatric oncology unit. Carlos is a member of the millennial generation. Carolina, Lisette's daughter, and Carlos's sister, resides in Miami, Florida. She recently graduated from the nursing program at Miami Regional University in August of 2024. Carolina is also a millennial. Lissette, let's start with you. You became an oncology nurse in 2010 after having worked in healthcare since 1995. Tell us what it was like when you first made the change to nursing. How did your earlier roles in the medical field affect your decision to become a nurse?
I decided to become a nurse after working 15 years in radiology. I work in a woman cancer center as a mammography technologist. And working over there, I found the passion to be working more closely with cancer patients, but I don't want it just to be taking the pictures or taking the images in the MRI for the patients, but also I wanted to do something more for them. I wanted to treat them. I wanted to be with them through the journey that they were passing through, and I wanted to do more for them. So that's why I decided to become a nurse in the oncology department.
So you saw the beginning of the journey and you wanted to see how it carried through.
Yes.
That's really nice. How do you think you being a nurse affected Carlos and Carolina and their decisions?
They grew up seeing the compassion, the dedication, the love that I have for my patients, that I wanted to do something more. In that calling, they were feeling it too. So I spoke to them when I was in radiology and I said, listen, I'm going to need your help because I want to become a nurse. And with that, they knew that I had to be working different schedules and study at night, working full time. So I asked them, and they were little, but I asked them for their help. And they agreed and they said, yes, mom, because we see that you want to do something more for the patients. And they helped me. I was working and they used to do their own chores and they helped me a lot.
So it was a true family affair.
Yes.
Nice to have that support. And I bet that showed how hard work can lead to a fulfilling career. How did you feel when your kids told you they wanted to be nurses?
I felt very emotional and very proud. And I knew that my children grew up with the same passion that I had. I was the most happy person in my life because they wanted to continue working with patients and give their love and compassion to them. So I was feeling very, very happy and proud.
What kind of advice did you give them?
I told them to don't forget the compassion with the patients. I told them that they have families, the patients have families, that they need their help, especially when they are passing through chronic diseases, to don't forget that giving all the caring and love for the patient, it can make the difference for the patients in the way that they receive and remember how they were treated.
That is one of the very special things about oncology nursing, is how we get to connect with our patients in that way. So giving that empathy, that love is so much a part of what we do.
I also reminded them that they had to be dealing with grief and loss, and they have to support the patients and the families during the difficult times.
And that must be hard for all of you, because dealing in oncology, sometimes we do see a lot of grief. And as a collective, your family gets to witness a lot of that. Do you see that reflected in the house at all?
Yes, being in the oncology nursing as a family, when I feel the necessity to talk to them, they listen to me, they pay attention, and we help each other to cope with especially when there is a loss of our patients. So we help each other, we understand, and we give the compassion and the advice that we need at that.
Oncology nursing changes almost every day. We see new treatments and new things, especially now as technology helps us move forward. How do you think nursing has changed since you first entered the healthcare field?
I see that the role of the nurses, like the traditional role that we had before, has changed. There is an evolution that there is more leaders, more professional. We are more accepted like leaders and like advocates in the new technologies in the areas of evidence-based practice. So the nursing career has more respect than before, because we are seeing now like professional. There is a professional career, not just nursing as helping in the bedside, but also as leaders.
I think ONS also helps to foster that for us as well. They've given us a nice professional home for us to land in and to share with our colleagues and build that professional image.
Yes, it was ONS that gave us the opportunity to participate in the advocacy policy, the health policy that we went to the Capitol Hill. So, and help us a lot to grow as leaders.
Advocacy is an important role for nurses, for sure. So, Lissette, one last question. Do you have any special memories or funny stories of Carlos or Carolina from nursing school or since they've become a nurse?
At the beginning of their nursing school, they changed the way they eat, the long days studying. And then they told me, wow, yeah, it was very difficult to go to nursing school and all the materials that they have to learn at the same time. So they were overwhelmed, but I was there to help them. And yes, I saw that the memories when I saw them like stress and eating sweets and chocolates. And yeah, so they remember what I passed when I was in the school. And they said, oh, now we understand when you were in nursing school. So we were making fun about that.
What was your favorite stress snack?
For me, chocolate, a lot of chocolate and a lot of coffee. Yeah.
How about you, Carlos? What's your favorite stress snack through nursing school?
M&M peanuts are easy to eat. They have lots of calories.
Excellent. And a little bit of protein.
Yes.
Excellent. So now, Carlos, how do you think your mom being a nurse influenced your decision to enter nursing?
It started even before she was a nurse. I remember growing up and she would always be in school and in the healthcare field. So I knew growing up I wanted to be in the healthcare field. she was the one that guided me into going to nursing because at a certain point, I wasn't sure what I was going to be doing. She guided me. And once I started doing nursing, this has been the career I've wanted to do. I want to continue doing. I'm very grateful for her guiding me into nursing.
It's nice when you can see that your parents are fulfilled and doing work that is valuable. And so I guess that translates. Do you have any particular memories from childhood about your mom studying or being in healthcare?
She would always be studying, but one thing that comes to mind was I sometimes work during the weekends, like long shifts. So I remember going with my dad and my sister, we would end up going to the hospital and we would pass by the cafeteria and we would try to have lunch together for a few minutes just to see each other. Because by the time she would finish, I'd be asleep already.
And so you became comfortable with the hospital environment even soon. That's great. Do you have any special memories or funny stories about your mom as a nurse?
One thing that comes to mind is that it's what actually led me into oncology nursing is how my mom would be such an advocate for her patients in case management.
You entered oncology nursing in radiation first?
I had started in the emergency room and I loved working with kids, but just hearing about what my mom would do in her job and even going into ONS, it's what led me into oncology.
What were your thoughts when Carolina decided to enter nursing school?
I mean, I was excited. It's funny because in nursing school, you'd always hear like when someone starts in nursing school, like then all of a sudden one nurse in the family ends up being many members of the family in nursing. That ended up happening with us as well.
Did you give her any particular advice?
Having a really good foundation, knowing the basics, learning, understanding why certain things are instead of just memorizing is very important. And then, of course, just testing strategies.
Did you help her study?
If there was something that she didn't understand or something that fell into like the emergency pediatric realms, then yeah, I would help her with that.
So now you're in pediatric oncology. What's that like?
Having to deal with grief, the loss of patients, it's not always easy, but just the fact that you have family, you have staff, it's good having a good support group. Sometimes we have family members that pass by visiting the department, maybe like 1 year, 2 years out, and having seen us for so long, we end up being like family to them as well.
I started my career in pediatric oncology also. It's very special. And I think for me, one of the nice things about it is that you really do care for the whole family and you get to know them because the children are in the hospital for a while.
And nowadays, since we have a virtual school, we have lots of kids actually, when they have an extended stay, they're still doing like their classwork and stuff in the hospital.
Oh, well, I'm glad I didn't have to make kids go to school while they were getting treatment. That might be one of the changes in oncology nursing that the kids might say isn't so great.
But we also have video game systems that's connected to the TV. So every kid, if they want to play some video games, when they get allowed to play.
That's awesome. Do you see a difference between when you were doing radiation medicine and now doing your pediatric oncology?
It's all tied in together. That's what I've noticed. Even for like the emergency room, the patient that I used to see would be kind of different. But at the end of the day, it's still nursing. You still have to care for the patient and the family. It's all very related.
Carolina, the last nurse in the family, how do you think your mom being a nurse influenced your decision to enter nursing?
Oh, she definitely heavily influenced me. She would always be very inspirational whenever I would see her studying so long. And when she finally got to be a nurse, I always admired her vocation and compassion with her patients. She'd always go above and beyond for all of her patients. I also got inspired a lot by my brother as well. Just seeing how passionate he was for caring for his patients and, like he said, for the families as well, and helping him deal with any grief or loss that they were experiencing.
That's an awful lot of studying you had to watch them do. How was it going to nursing school after all of that? Was it helpful to have those two nurses in the family?
Yes, they were definitely helpful. Anytime I had a question, I would ask them. They would always help me out, make sure I fully understood. It would actually be a little funny because sometimes they would overexplain and I was a little overwhelmed and I would have to be like, okay, let's dial it back. Get back to the basics.
Yeah, you forget how much you know that you absorb. What was the best piece of advice that maybe your mom gave you and Carlos gave you?
It was definitely, I'm not just taking care of the patients, it's taking care of the entire family. it isn't just being bedside. It's about advocating for them, making sure that they're getting the treatment that they need and deserve, making sure that they have their voice heard as well.
That can be hard to do sometimes. How do you think nursing is different for you now compared to when your mom and your brother first started or went to school or any piece of it? How is it different now?
So when my mom was going to school, it was during that transition from paper charting to electronic. I remember her always telling me about the new way of doing things, the new technology. And I remember for my brother as well, like more apps were being used when he was in school, the digital tools being used a lot more. I was actually one of the students that started doing the new NCLEX. And that's something that whenever I would talk about to my mom and my brother, they were asking you what now? Because it's when the NCLEX, it would ask a lot more case studies, ask you a lot about critical thinking and clinical judgment. Either way, they were always helpful with me in anything that I was going through in school.
The NCLEX is certainly something that's changed since I've been a nurse. I'm on the cusp of being a boomer, and we sat for 2 days to take the NCLEX exam with a pencil. The only thing you could bring in was 2 number 2 pencils and a tissue, I think. For 2 days, we were in an armory, and they had tables lining the armory, and you'd file in, you'd take your seat, and then you'd take your test. So it's very different now, isn't it?
Oh, definitely. Everything was, for me, electronic. I was just on a computer for approximately 2 hours or so.
2 hours is a lot different from 2 days. But that's how fast and how quickly I think nursing changes. And again, oncology nursing does the same, keeps pace with that. Do you have any special childhood memories, Carolina, about funny stories about your brother or your mom, or memories about mom being a nurse?
Definitely. Kind of like going on what my brother was saying about how our dad would try to take us whenever she had a break to at least have some meals together, the hospital. Another thing is that I do remember that sometimes she would get out of work late and we would always try to go to Denny's at 2 a.m.
Oh, gosh.
Yeah. I mean, I was a child, so I thought it was a night out.
It's an adventure.
Yes, definitely. Something else was also whenever we needed something, we would have to go through the process being like, is it emergency? No. Okay, then we'll leave it for later. Are you injured? No. Okay, then let me sleep these few hours I have. Are you bleeding? All right, let me see. It's not a big deal. You can go on. Same thing with my brother. He would always be like, are you joking? Oh, I hear you breathing. I hear you coughing. You're breathing, so you're good. So on and so forth.
Spoken like a true emergency room nurse.
Yes, definitely.
Do you find sometimes that there's more compassion in the hospital than there is at home?
That's a really good question. I want to say yes, they're definitely, I feel like maybe they do at least see me as not a whole patient, but there's still compassion.
Yes.
Maybe less professionalism, but that's obviously a family thing.
That's a family thing, indeed. We have that here at this family too. You know what here's a funny situation. Carlos and Lissette, you both worked at Baptist Hospital, South Florida. What was that like?
Oh, when I used to work, they are connected, the outpatient with the inpatient. So sometimes we see each other in the cafeteria and we say hi. And sometimes we had times to eat together. And also it was nice to see him with his friends, his coworkers. And then they say, oh, that's your mom. And he says, oh, you are young. And that was super nice. And also when they say he's a great nurse, I was like very proud. Yeah, it was very interesting. Sometimes we share the same patients because as a case manager nurse, the patients had to go to the radiation oncology. And when I needed to expedite an appointment, I used to call him, please help me with this patient. I need to accommodate this patient in between the schedules. And also when he needed to advocate for that treatment or a medication. So he used to call me, this patient needs this medication. So it was good to be working in the same hospital, even though that he worked in the radiation oncology and me in the case management.
So you never worked on the same unit exactly, but you shared patients. That's awesome. Carolina, would you ever want to work in the same unit or hospital with your family?
Oh, yes, definitely. I would love to have that opportunity.
All three of you together. I can see it now.
Yes, that would be great. I would be the proud mother because they are very great nurses and very professional, good kids, and they advocate for the patient. They love the patient. So I'm a very proud mother.
I bet you are. I would be too. And they sound like wonderful people as well.
Thank you.
Especially if they're going to eat with their mom at 2 a.m. in Denny's.
Yes.
So what's the best thing about having all these nurses in your family?
It has been great, especially they help me a lot with the technology. So when people see me like, my age and they see me, they say, wow, you know about technology. And I said, yeah, because my children help me. And that's wonderful because they grew up with the new technology and I didn't. So it feels very great to know to navigate the EMR system and very easy to transition from one EMR to another. And it's great because I learned through them. Not all the nurses had that opportunity to transition to the new technologies. And I had that opportunity through my children. So it's great.
That's the great thing. What's the hardest thing?
The hardest thing is when I see them that, for example, Carlos, that when he lost one of his patients in the radiation oncology, and when I see him, that affected by that. So that's one of the hardest things that to share that story. But also, even though that is sad, it's good for him to have me and give them the support that he needed at that time. That's one of the hardest things, because we love our patients in radiation oncology. They go for a long period of time for the treatment and tell them goodbye, especially pediatric patients. Very hard.
Carlos, what's the hardest thing for you, having all those nurses in the family?
Everyone has different shifts. I remember a lot of times for holidays, either one of us couldn't be there or sometimes one of us would be on call. In radiation oncology, sometimes you have to be on call and then getting called in like in the middle of the night.
Carolina, anything come up for you? Something good or something hard about having so many nurses?
I agree with the whole shift, the differences in shifts. It's been a lot harder to, be able to sit down and have a meal together like we used to. Seeing how they get affected by their patients when there's not such a good prognosis that they received with one of their patients. But we try to be there for each other any way that we could. Otherwise, on the good side, it's really interesting just being able to help each other out professionally whenever there's something that I don't understand or maybe they don't understand, like that my mom didn't understand. Like I always seen like my brother, my mom helping each other out, like really makes me want to learn more so I could also help them.
Yeah, I can add the holidays is one of the most difficult also. For example, for Mother's Day, and Carlos has to work. So he always asks me, when can we celebrate Mother's Day? When can we do a Saturday instead? And coordinating all of that. But since we are all nurses, it's really good to understand. We understand each other in that sense. So he has to work Sunday. That's okay. We celebrate another days. We always coordinate according to our shift.
That's good to have that flexibility. I would imagine getting everybody together all at once is tough. So when you do sit around the dinner table, do you talk about the hospital?
Yeah, that's one of the things that my husband used to complain. Because every time that we are on the table, we're talking about medicine, about treatments, advocacy, about ONS, oncology nurses. And that's one of the things, yeah. Yes, that's the other family that they are not part of the nursing. They said, oh, here we go again.
So I guess he's not a nurse.
No.
So how has having nurses in your family shaped your understanding of the different generations in the workforce? Does it help you to relate to other people within the units that you work as well?
One of the things I see is that nurses, we could work anywhere. Anywhere you go, you always see a nurse. And even though if we have different backgrounds, different specialties, we sort of understand one another.
And me as a mother, when I see a new nurse, a baby nurse, I understand and I help them, they are new. And I see there is my children there. So I help them and guide them. And yes, it helps having children. So we relate more with the other nurses.
So you treat the baby nurses like you would want your children to be treated.
Correct. Yes.
I can see that.
In my case, I guess I tried my best to help out my older coworkers whenever they don't have something they don't understand, like on the computer or anything like that. As a millennial, I try my best to get them up to speed, I guess you could say.
Yep. Well, we need you, so please don't ever stop. Any last thoughts? Anything else you'd like to share about coming from a family of nurses? Do your other relatives call you when they have problems?
Yes. They call us when they have a disease or when they have symptoms, and they call us. And they know how to, for example, my sister, she calls my son, oh, he's the pediatric nurse. And to me, oh, we need something related to case management. Is this Medicare going to work? Is this insurance? And yeah, the family call us according to our roles. They call us and they ask.
Yep. You know, it's funny. I was going to say, do they call the house and then whoever picks up, it doesn't matter. But we don't function with our telephones that way anymore. You get to call the person you want specifically because they have their own phone. That's great. And Carolina, where do you see yourself working?
I believe I'll also work in oncology. That's where I want to work.
Well, we're happy to have you. As we conclude this episode, I'd like to thank each of you who joined us today, Carlos, Carolina, Lissette, for sharing such wonderful stories of oncology nursing throughout the years, as well as what it's like to share the experience with your family. Your experiences are made all the more special by sharing them with one another, and thank you for sharing them with us. It's clear that while there are differences across our generations, there are also so many similarities. I wish you well, and I hope that you continue nursing as a family together throughout the years to come.
Thank you. It was a pleasure.
Thank you for the opportunity.
Thank you once again for having us.
Thank you for listening to the ONS podcast. Tell us about your favorite part in this episode by leaving a review wherever you download your podcast. For more resources and information about oncology nursing, visit us at ons.org and ons.org/voice. The ideas and opinions shared in this episode represent those of the guest and not necessarily ONS.